Good morning, I'm Mabel Jung, and you're watching continuing coverage of the World Healthcare Congress here in Washington, D.C. And our first interview of the day is Horace Blackman, VP of Health and Life and Sciences at Lockheed Martin. Good morning, Horace. How are you?
Good morning, Mabel. Thank you very much for having me.
Well, we know Lockheed Martin as a leader in engineering technology, and I understand it is very active in the health IT space. It's been for 29 years a leader in this area. So tell me, how involved is Lockheed and what it's really doing right now?
Well, first of all, Mabel, the two things, being a leader in engineering and being a major player in healthcare, absolutely go together. I mean, Lockheed Martin has a long and rich history of engineering complex solutions to address the mission needs of a lot of different industries, whether it's aerospace, defense, or whether it's the mission space within the government. Healthcare is no different. If you think about what you do in healthcare right now, how you manage your electronic health records, and the complexity around that, we actually pay and support the Social Security Administration in processing about $600 billion worth of disability and retirement payments every year. We run the infrastructure for the Center for Medicare and Medicaid Services, which processes all of the disability and Medicare and Medicaid payments. We provide support for the Centers for Disease Control and Prevention in their efforts to combat epidemics such as Ebola. And we actually work with organizations like the Department of Veterans Affairs in their Million Veterans programs, which is their genomics program to actually capture, process, and analyze the genetic information of 1 million veterans.
Wow, that's impressive data. Now, you're also very active in the movement to virtualize medicine. What is Lockheed engineering in this area, and how significant will that be for the sector as a whole?
So virtualized medicine is extremely important. Within healthcare, there are a number of critical challenges. Challenges including availability of clinicians. We take for granted living in a major city that we can go around the corner and find a doctor of any specialty or any type pretty readily. In many parts of the country, and certainly in many parts of the world, that's not the case. So when we think about virtualized medicine, and we think about telehealth, et cetera, it gives the ability for folks that reside and happen to be in places where there's not the same level of availability of clinicians to have that access to those clinicians wherever they may be. That's the first. Secondly, it also allows organizations to uniquely address their mission in different ways. There are instances where, for instance, NASA, if you have an astronaut on the space station, you can't really have a house call from a doctor. We have to find unique and creative ways to monitor the health, the vital signs, and the performance of that person in space. That's not dissimilar to what we may do in a battlefield situation, in a remote Arctic ice station, or within certain parts of the United States that are remote in nature, whether it's Alaska or some other places along those lines.
Can you give me some example of actual products?
Absolutely.
And also, will these be available to regular civilians, if you will?
Well, some of it already is. We are working on a number of fronts, on the telehealth fronts, where we do things such as allow dermatologists who are sitting in Seattle, Washington, to actually perform dermatological exams on patients in Anchorage, Alaska. And what we do there, we actually have a platform, a telehealth platform, which enables the use of high-definition cameras that clinician in Seattle to be able to make observations of that patient in Anchorage and make real diagnosis, obtain vital information, and outline treatment regimes from 3,000 miles away.
Do you envision a day, Horace, well, we're already being encouraged to educate ourselves about our health choices, to go online to shop for our health plans and so forth, but do you envision a day where people will be doing very simple procedures, because you're talking about doing things virtually, maybe instructing someone who's actually on site to help a friend or a colleague get through a medical situation, but you also see us doing things to help ourselves in this area.
Well, Mabel, that day is here right now. Today, they have companies that we partner with, and they're actually solutions that we're pioneering that allows things such as the delivery of therapeutic services, such as folks who are doing rehabilitative services for injured limbs, arms, etc., to go through their physical therapy using a video-based solution. We actually have situations today where we can actually have folks conduct face-to-face counseling sessions for TBI patients, and actually have intervention for things like the suicide hotline, where instead of before it was a phone-based system, you now have a video-based system where you can have a face-to-face interaction with a clinician or a counselor from as much as 3,000 miles away.
Identify for me some trends that you see coming.
Well, if we think about the role of information technology as it pertains to how healthcare is delivered, certainly we've seen a lot of things happen there. One trend we're likely to see is the continued expansion and integration of information technology within the health sector to do many things. We talked a little bit about virtualized medicine, telehealth, telepsych, and counseling. You're going to see more things happening. Right now, we are seeing a movement towards electronic health records. So the same way in which you have the availability of your credit records and other records you may have, banking records, whatever the case may be, you're going to have access to your health records to make meaningful decisions and be able to extract information that may inform life choices you may have, whether it's dietary choices, whether it's health choices, or whatever the case may be. So that's the first thing. And that also happens on the back end too. You know, the days where you went to your doctor's office and you say the giant file storage cabinet of files and paper, that trend where you will see less and less of that's going away. So you're going to see that file room of all your patients where your doctor would go to a room and take your file and open it and all your medical records over there. That's now going to be computerized. And not just computerized for your individual primary care physician, that's going to be put in the cloud. So he's able to access that, and the specialists that you get referred to have ready access to that information. And in addition to accessing information, clinicians are going to be able to leverage the ability to use the technology to perform advanced analytics, to see trends that are at play within your medical records, to observe things that now take a lot of analysis. Some of those types of analysis you may have may actually be something that may take a week before, to actually look at blood samples and think about what it means in terms of drug interactions and things you're doing in your diet. Some of those are going to be collapsed, and we're going to be able to see those in a matter of minutes.
Exciting stuff.
The second trend I think that we're going to see is the notion of the importance of information security within your health records. We think about the importance of our credit records, or financial records, or credit cards, whatever the case may be, but we're going to find that it's equally important to protect information about our health. And you look in the news right now, you hear about data breaches within healthcare systems, et cetera. That just underlies the need for a robust security infrastructure to protect the medical records within the public domain, whether it's your hospital, whether it's the Department of Veterans Affairs or any other department of government, or if it's just your private doctor. The third is, and this gets into sort of how things are done. You're going to see the increased commoditization of the IT infrastructure that is used to support and process the information pertaining to your health. There were days when health information, like credit information, were stored in computer rooms and data centers with giant banks of computers, and you basically had this expensive infrastructure that if you thought about the fact that your doctor couldn't afford to do that, that's why you still had these rooms full of paper, that's going to go away, because right now, we're at the stage where you can actually have your genome sequence for your whole body and put that data on an iPad, tablet computer, right? And you can walk around with it, and your doctor can actually use that information at that scale to help walk you through how to make meaningful decisions about your life, about your health, about the choices you make, about your diet, or whatever the case may be. So you're going to see more and more of that as we go through this process.
Okay, well, we certainly look forward to many more things to come. Thank you so much, Horace.
Appreciate it. Thank you very much.
And I'm Mabel Jong. Thanks for watching.